Breaking news just dropped. FDA approved the GLP-1 pill yesterday. This isn't theoretical. Official announcement came out December 22nd, and here's why it changes everything for Looksmaxers right now. For years, GLP-1 meant injections, weekly shots, needles, refrigeration, hassle. Most people rejected it because of that barrier alone. Now there's a pill. Same results. Way cheaper. Available in early January. By the end of this video, you'll understand what just changed in the optimization landscape and why the timing matters for your protocol right now. FDA official approval came through December 22nd, 2025. Novo Nordisk's Wegovy pill, oral semaglutide 25 milligrams. This is officially recognized now. Here's what the announcement actually said. Clinical trial data from OASIS 4, 307 adults, 64 weeks of treatment. The oral version delivered an average weight loss of 13.6% versus 2.4% placebo. Compare that to the injectable version. 14.9% weight loss. Essentially identical. Same mechanism, different delivery. The scale of this, Novo Nordisk says they're already ramping up US manufacturing in North Carolina. Robust supply is on hand right now. Production is ready. Most people are just celebrating that it's approved. But here's what actually matters. This breaks down the injection barrier that was stopping people from accessing GLP-1 in the first place. That's not hype. That's a real shift in accessibility. Here's why this matters more than people realize right now. Here's the direct impact for anyone considering optimization right now. First, accessibility barrier is gone. The injectable version worked, but people rejected it because needles are friction. Refrigeration is friction. Cleanup is friction. A pill removes all of that. Second, cost just got competitive. Novo Nordisk announced $150 per month for the first 4 months for self-pay patients. That's the lowest GLP-1 pricing in the market right now. After 4 months, it's $199, still competitive. Compare that to what you're paying for injectable versions, $200 to $400 per month, depending on supply and source. Third, legitimacy just increased. This is FDA approved now. It's not compounded, not sourced from sketchy suppliers, not a loophole. It's official pharmaceutical supply. For Looksmaxers, this changes the decision calculus immediately. What was expensive or risky or friction-filled is now accessible and cheaper and official. Fourth, timing matters. Availability starts early January 2026. That's less than 2 weeks from right now. If you've been waiting for better options or lower prices, that window just opened. And here's what the data actually shows about this advantage. Let's look at what the clinical data actually proves versus the hype people are already spreading. Official statement from Novo Nordisk. The oral version achieved approximately 17% weight loss if all patients stayed on treatment. That's the idealized scenario number. The real world number, regardless of if people stayed compliant. 13.6% weight loss. That's the number that matters for actual use. It's still massive. It's still clinically significant. The OASIS 4 trial excluded people with diabetes, so this is pure weight loss in non-diabetic populations. That's important context. Mechanism is identical to the injectable. GLP-1 receptor agonism. Slows stomach emptying, reduces appetite signaling, improves satiety. Same biological pathway, different delivery method. What about side effects? The announcement listed the same adverse reactions as the injectable version. Nausea, diarrhea, vomiting, nothing new, nothing worse. Here's what matters for the looksmaxing angle. This is genuinely equivalent to the injectable, not a weaker substitute. The data shows that. Researchers quote it as overcoming historic bioavailability challenges with peptide-based medications. Translation, this actually works as well as the shot. Is this revolutionary? No. Is this a real upgrade to accessibility? Yes. Right now, that's what matters. Here's what happens next in the market when this goes live. Timeline. Matters here because the landscape shifts immediately. Distribution starts early January. Multiple telehealth platforms are already ready. Weight Watchers Med Plus is offering it. Direct pharmacy access begins. Transcend's shutdown left a massive gap in the TRT clinic market. This GLP-1 approval is filling that void with legitimate alternatives right now. Supply ramp-up happens fast. Novo Nordisk confirmed robust supply on hand. This isn't a shortage situation. This is a competitive launch. Manufacturing is ready in North Carolina. They're not sitting on inventory waiting for hype. They're prepared to ship immediately. Market competition enters next. Eli Lilly is submitting their own oral GLP-1 candidate, or orforglipron, by the end of 2025 for approval in 2026. That means price pressure builds. Cost drops further. Tirzepatide, which we covered recently as beating semaglutide head-to-head, is also now competing at this price point. The market is consolidating around oral delivery. Within 90 days, expect accessibility to double. Expected cost to drop another 15% from increased competition. This is what market disruption actually looks like. Here's what that means for your protocol right now. If you've been waiting for better options, that window opened yesterday. If you've been rejected GLP-1 because of injections, your barrier is removed. If you've been priced out, competitive pricing just entered the market. If you were using compounded GLP-1 before the FDA restrictions hit, you now have a legitimate alternative. The Looksmaxing community move is obvious. Shift from injectable to oral. Same results. Lower friction, lower cost, better access. But here's what most creators are missing about this approval. The real story isn't the pill versus the injection. The story is what this signals about the future of Looksmaxing optimization. For years, Looksmaxing was fragmented. You went to one clinic for TRT, another for peptides, a third for cosmetic consultations. Each had different pricing, different quality, different legitimacy questions. Now you're seeing consolidation. GLP-1 is becoming the standard tool. Oral delivery is becoming standard. Legitimate, approved pharmaceutical supply is becoming standard. Price competition is forcing accessibility. This is the opposite of the Wild West peptide market. This is mainstream medicine acknowledging that weight optimization through pharmaceutical means is legitimate healthcare. Not controversial, not fringe, standard. The FDA approval signals that GLP-1 for weight loss is now established protocol, not experimental, not something you argue about. It's approved. It's available. It's the new baseline. What that means, every clinic, every telehealth platform, every legitimate provider now has to offer GLP-1 or they're behind the curve. Price pressure increases. Quality standards increase. Access increases. The Looksmaxing landscape just shifted from, is GLP-1 worth it? To, which GLP-1 formulation should I use? That's a massive mindset shift, and it happened yesterday. Anyone still injecting weekly when a daily pill delivers equivalent results is now making an active choice to accept higher friction. That changes behavior. That changes market dynamics. Here's what you actually need to understand. This approval isn't just news. It's a signal that the optimization market is mature, becoming legitimate, becoming accessible, becoming standard. That's the real breaking news. Here's what breaking news actually means when it matters. Breaking news is only important if it changes your actual options. This does. You just went from limited, expensive, friction-filled access to legitimate, official, competitive options available right now. That's a real shift, not hype, real change. The window to make this switch is open. The pricing is competitive. The supply is ready. The data is proven. The timing is now. But more importantly, this signals that the optimization era is becoming mainstream. What was once fringe or controversial is now FDA approved and widely accessible. That's the real story. This isn't just about GLP-1. This is about how fast the optimization landscape changes when government and pharma align with market demand. If you want breaking news about optimization developments the day they happen, subscribe now. This channel covers the real shifts that change the landscape, not the hype everyone else is pushing. Comment below. Are you switching from injectable to oral GLP-1, or are you waiting to see what happens next?